President Obama is asking Congress for nearly $2 billion to fight the Zika virus. The CDC command center is now at its highest alert level in response to the disease. Officials warn it could spread in the southern states. Events that draw big crowds like the Mardi Gras in New Orleans may be breeding grounds for the virus. David Begnaud is in the French Quarter with ways to prevent it from spreading. David, good morning.
Gail, good morning from Bourbon Street and happy Mardi Gras. You know, about 1 million people are expected to descend on the city, and I can tell you, being from Louisiana, it's something you want to experience. But federal authorities now say the Gulf Coast, Louisiana, up and down the South, they could experience a new pandemic, Zika.
The Centers for Disease Control and Prevention say its Emergency Operations Center is functioning at its highest alert level in the fight against the Zika virus.
We are working 24/7 to understand this virus. Time is really precious for this kind of emerging infection.
At the White House Monday, the principal deputy director for the CDC, Ann Schuchat, said her agency could respond with SWAT teams.
We do think it's likely that we'll have limited local transmission in some of the southern states. In the winter months now, we have a chance to really try to get ahead of this.
The vast majority of Zika is spread by the Aedes aegypti mosquito, which in the U.S. is seen primarily in the southern states. At least 57 cases of Zika have been reported in the U.S., in 12 states and the District of Columbia. The World Health Organization calls Zika a global health threat. The virus is spreading rapidly through Latin America, and its connection to the birth defect microcephaly has led to warnings and travel restrictions for pregnant women.
Any illness that's mosquito-borne that people might get overseas might then be brought back to the United States.
Dr. Yoko Furuya specializes in infectious disease prevention at New York Presbyterian Hospital. She says there is one simple way to fight mosquito-borne illnesses.
Mosquito repellents are a good way to try to avoid it.
Consumer Reports recently tested 15 insect repellents that are on the market right now. Brave testers stuck their arms into a cage of 200 disease-free mosquitoes.
We found that the insect repellent that was most effective against the type of mosquito that carried the Zika virus were the ones that contained 20% picaridin and 25% DEET.
Senior editor Sue Byrne says repellents with 100% of the active ingredient DEET are no more effective at fighting Zika and carry troubling side effects. But she says products with natural ingredients were not effective.
Products made with natural plant oils just did not do the job against mosquitoes.
There is no diagnostic test or vaccine for Zika right now, and quite frankly, it's simply too cold for the mosquitoes that would carry the Zika virus. However, the concern is as we move into the summer months, those mosquitoes come out and the concern becomes very real. Nora.
Very real indeed. David, thank you so much.